Chapter 7, Axial Skeleton, Part 2. So, we're now moving on to the vertebral column. Vertebral column has many important functions. It houses and protects the spinal cord. It acts as a strong, flexible rod for movement, so we can bend and twist our torso, and also it supports the head. The skull, after all, rests on top of it. And it's attachment site from the ribs, the pelvic girdle, and various muscles. Lots and lots of muscles. So you can break the vertebral column into a few distinct pieces. You have the cervical vertebrae, 7 cervical vertebrae in the neck region. You have the thoracic vertebrae, 12 thoracic vertebrae. They attach to the ribs. The 5 lumbar vertebrae, and then the sacrum and the coccyx, which actually these two bones are actually fused vertebrae. So the way to remember how many of the different kinds of vertebrae there are is to remember breakfast, lunch, dinner. So cervical vertebrae, there are 7 cervical vertebrae, so that is breakfast at 7. Thoracic vertebra, 12 thoracic vertebra, that is lunch, have lunch at noon. And then lumbar vertebra, 5 lumbar vertebrae, that's dinner, nice early dinner at 5. And of course sacrum and coccyx. So breakfast, 7 cervical, lunch, 12 thoracic, dinner, 5 lumbar. Between the bodies of the vertebra are fibrocartilaginous structures called the intervertebral discs. They help to endure compressions and absorb shocks so that our vertebrae don't have to click together when we sit down hard or something like that. A condition that can be developed is called a slip disc. This is when part of the outer, more tough layer of the intervertebral disc gets damaged and some of the more squishy internal parts ooze out and press against spinal nerves, causing pain. So a slip disc is actually a slight rupture of an intervertebral disc. All right, our vertebral column is not a straight line. It's actually very curved. So we have the cervical curvature that are convex toward the anterior side, thoracic curvature, concave, curving toward the posterior, lumbar curve, convex, curving toward the anterior, and the sacral curvature, concave, pushing toward the posterior side. It's possible to have issues with the curvature of your vertebra. One disorder is scoliosis. Scoliosis is a abnormal lateral curvature. We should not have lateral curvings of the vertebral column. This often occurs in the thoracic region, can make difficulty walking, be very painful. Another disorder is kyphosis. Kyphosis is an exaggeration of the thoracic region, also known as hunchback. So this is more common in elderly folk as they, over time, start to lean over too much, leading to the development of the kyphosis. Lordosis. Lordosis is exaggeration of the lumbar region or swayed back. Can occur in pregnant women, but it also can occur in anyone and lead someone to look like they are pregnant as their abdominal organs get pushed out anteriorly. Here is the typical vertebra. On all of these vertebrae, you will expect to see a hole called the vertebral foramen. This is where the spinal cord will pass through. This hole is formed by various structures. We have the body, this big chunk of bone. It helps to form part of the vertebral foramen. Then we have this bone tissue that comes after the body on either side. That is the pedicle, and that's followed by another set of bone tissues on either side called the lamina. So to form the ring of bone tissue to get our the vertebral foramen, we go body, pedicle, lamina, lamina, pedicle. So again, body, pedicle, lamina, lamina, pedicle. We have some processes sticking out of the vertebra. We have sticking posteriorly out the spinous process, very thin, very pointing out. If you rub your hand along your back, those bumps you feel are the spinous processes of the vertebra. Then we have 2 processes sticking out laterally. These are the transverse processes. The 7 cervical vertebrae. All of the cervical vertebrae are relatively small, and they all possess these extra holes called transverse foramen. So they have these extra holes in their transverse process called transverse foramen. So if you see those, you know you have cervical vertebrae. Atlas is the first cervical vertebra, C1. It is the one that articulates with the occipital bone. So it is the smooth surfaces where the occipital condyles or the occipital bone will rest on the atlas. That gives us the joint that allows us to nod our head yes. As you can see, the atlas lacks a spinous process and it also lacks a body. C2 is called the axis. The axis looks like a normal cervical vertebra, except it has this extra piece of bone tissue sticking up superiorly called the dens. This piece of bone tissue articulates with the atlas and allows us to form a joint that lets us turn our heads to shake and say no. Thoracic vertebra. 12 thoracic vertebrae. They are making joints with the ribs. So they have these extra smooth facets on their bodies and on their transverse processes. These smooth facets are where they're forming joints with the ribs. So if you see these extra facets, you have a thoracic vertebra. Lumbar vertebrae. Lumbar vertebrae are the biggest, heaviest. They have to hold up the most weight. They do not have extra holes. They do not have extra facets. So if you compare to 3, cervical vertebra, small, has transverse foramen, extra holes. Thoracic vertebra, medium size, has these extra facets. Lumbar vertebra, largest, and has none of those extra features. Sacrum and coccyx. They are fused vertebrae. It actually takes a relatively long time for them to fuse, so they don't fully fuse until you're a teenager. And they're the inferior portion of the vertebral column. Moving on to the thoracic cage. Thoracic cage. Lots of functions, including enclosing and protecting organs, heart, lungs, and so forth. Provides support for the upper limbs, so the upper limbs actually attach to the sternum. And it aids in breathing. It's a little expandable for when we are breathing. So the sternum or breastbone, right in the center anterior region of the thoracic cage, has 3 pieces: the manubrium, which is superior, the body in the middle, and the xiphoid process, which is inferior. And it doesn't fully fuse until someone's around 25. Also forming the thoracic cage are the ribs. There are 12 ribs on each side. Their names are 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. They are attached to the sternum, usually. And when they are attached, it's via costal cartilage, that hyaline cartilage. Turns out ribs 1 through 7 are called the true ribs because they attach directly to the sternum. Ribs 8 through 12 are the false ribs because they either attach indirectly, their costal cartilage attaches to rib 7's costal cartilage, or they don't attach at all. And then finally, ribs 11 and 12 are also known as floating ribs because they do not attach to the sternum at all. Here is a rib. We see on the rib that it has a head, a neck, and a large rough patch called a tubercle. The head and tubercle are where it forms joints with the vertebra. So here is the rib, here's its head, forming a joint, a contact with the body of the inferior vertebra, and also with the vertebra above it. So it's contacting 2 vertebrae with its head, one above and this one. And then it also makes contact with this vertebra at the vertebra's transverse process. So the tubercle makes contact with the transverse process, the head with the bodies. So that means one rib forms 3 joints, 3 articulations with 2 different vertebrae. And that is it for this lecture.